Breaking tonight, new weight loss drugs are transforming millions of lives around the world. But behind the dramatic before and after photos and impressive scale readings, experts are raising serious warnings about risks that many users remain unaware of.
GLP-1 medications are transforming how we treat diabetes and obesity and are now widely being used for weight loss. But patients need to be aware of the risk and potential side effects and use them only under proper medical supervision. They're powerful tools, not quick fixes.
Often referred to simply as ozempic, these medications belong to a class of drugs known as GLP-1 receptor agonists. They are marketed under several well-known brand names including Wegovy, Zepbound, Saxenda, and Mounjaro. Originally developed to help manage type 2 diabetes, these injections have exploded in popularity for their remarkable ability to promote significant weight loss. Their rise has been nothing short of meteoric, with prescriptions surging year after year as demand continues to outpace supply in many countries. There is no denying the revolutionary impact of GLP-1 medications on weight management. These drugs work by mimicking the natural hormone glucagon-like peptide 1, GLP-1, which regulates appetite and digestion. By signaling the brain that the stomach is full and slowing gastric emptying, they help users feel satisfied with smaller portions and reduce overall food intake. For many patients who have struggled with obesity for decades, the results can feel almost miraculous. Clinical studies have shown average weight loss ranging from 15 to 20% of body weight over time, far surpassing what most people achieve through diet and exercise alone. Beyond shedding pounds, emerging research suggests these medications offer additional health benefits. They can improve blood sugar control, reduce harmful cravings for sugary and processed foods, and even lower the risk of major cardiovascular events in certain high-risk patients. For individuals living with obesity-related conditions such as high blood pressure, sleep apnea, or joint pain, this can represent a genuine life-changing breakthrough.
Some patients on these GLP-1 medications have had great success, while others have experienced serious side effects.
Yet as with any powerful medication, the full story is far more complex than the success stories suggest. Medical professionals are increasingly highlighting a range of side effects that can range from uncomfortable to serious. Doctors report that up to 40% of patients experience nausea, especially during the early weeks of treatment or when dosage is increased. This is often accompanied by other gastrointestinal issues, including vomiting, bloating, and excessive gas, constipation or diarrhea, abdominal pain and discomfort, a persistent feeling of fullness that can make eating unpleasant. Just that for some users, these side effects are mild and temporary. For others, they become severe enough to interfere with daily life and force them to discontinue the medication altogether.
I did lose weight, but the nausea was really difficult at times.
The root cause of many of the challenges associated with GLP-1 medications lies in how these drugs fundamentally work within the body. GLP-1 drugs deliberately slow gastric emptying, which is the process by which food moves from the stomach into the small intestine. By extending the time food remains in the stomach, these medications create a prolonged sense of fullness, helping patients feel satisfied with smaller portions. While this mechanism is highly effective for appetite control and weight management, it can disrupt the natural rhythm of digestion. Food lingering in the stomach for extended periods may cause bloating, discomfort, and even a slowdown in normal digestive processes, which can be particularly noticeable in the early weeks of treatment or when doses are increased. For some patients, these digestive effects are mild and manageable, but for others, they can be significant enough to interfere with daily routines, creating discomfort during meals or after eating. This impact on gastric emptying has implications that go beyond daily digestion. Surgical and anesthesia considerations are a major concern. Anesthesiologists now advise that patients on GLP-1 medications may have delayed stomach emptying even after fasting for many hours before surgery. If residual food or liquid remains in the stomach during general anesthesia, it increases the risk of pulmonary aspiration, a serious and potentially life-threatening condition in which stomach contents enter the lungs. This complication can lead to severe respiratory problems, infections, and prolonged recovery periods. Because of this, new preoperative guidelines now emphasize that patients must inform their surgeons and anesthesiologists well in advance if they are using GLP-1 medications. In some cases, doctors may recommend pausing treatment before surgery to reduce these risks. This guidance highlights how even a seemingly routine medication can carry implications that require careful planning and professional oversight. While most side effects of GLP-1 drugs are related to the digestive system, rarer but more serious complications have also been reported. These include severe allergic reactions, anaphylaxis, and pancreatitis, an inflammation of the pancreas. In such cases, the medication must be discontinued immediately, and some patients may be advised not to restart it due to the risks involved. Because of the potential severity of these effects, ongoing monitoring by a healthcare provider is essential. Regular check-ins allow doctors to catch complications early, adjust dosages as needed, and provide guidance that helps patients continue safely on their weight loss journey. Another increasingly recognized concern among healthcare experts is the unintended loss of lean muscle mass. Unlike traditional weight loss methods, which often target primarily fat when combined with exercise, GLP-1 medications can lead to the loss of both fat and muscle tissue. Lean muscle is crucial for maintaining metabolic rate, physical strength, mobility, and overall long-term health. Significant muscle loss can contribute to slower metabolism, decreased energy levels, and weakness, potentially increasing the risk of injury or falls, particularly as people age. Experts warn that without appropriate interventions, patients may lose not only fat, but also the very muscle that supports functional independence and long-term vitality. To counteract this, specialists strongly recommend pairing GLP-1 treatment with a high-protein diet and regular resistance or strength training exercises. Nutritionists stress the importance of balanced nutrition because these drugs suppress appetite so effectively that some patients unintentionally consume insufficient calories and essential nutrients. Undereating can lead to deficiencies in vitamins and minerals that are vital for overall health. To prevent this, experts advise increasing protein intake through sources such as lean meats, eggs, dairy, or plant-based proteins. Incorporating fiber-rich foods to support digestion and reduce constipation, and considering high-quality multivitamins when necessary. These strategies help mitigate muscle loss, support metabolism, and maintain energy levels throughout treatment. It is also crucial to remember the original purpose of GLP-1 medications, managing blood sugar in individuals with diabetes. Even among non-diabetic users, these drugs can affect glucose regulation. Some people, particularly those with insulin resistance, may experience reactive hypoglycemia characterized by sudden drops in blood sugar after meals, especially meals rich in carbohydrates. Symptoms can include shakiness, dizziness, sweating, and fatigue, all of which can impact daily activities and overall well-being. Healthcare providers often recommend a balanced, lower carbohydrate diet to help stabilize blood sugar levels, combined with frequent monitoring to detect fluctuations early. So what does all this mean for patients considering or using GLP-1 medications? These drugs are undeniably powerful tools that have helped millions of people achieve weight loss that was once extremely difficult, if not impossible, to sustain. They represent a major advancement in the fight against obesity and obesity-related diseases, offering a scientific breakthrough for appetite regulation and metabolic health. However, they are not magic pills or standalone solutions. Like any medical intervention, they carry real risks and require thoughtful management by qualified professionals. The most successful outcomes are achieved when patients work closely with doctors, dietitians, and healthcare teams who can monitor side effects, adjust medication dosages appropriately, and provide guidance on sustainable lifestyle modifications. Lasting health improvements depend on a comprehensive approach that includes smart nutrition, regular physical activity, resistance training, and long-term behavioral strategies. Weight loss achieved through GLP-1 medications without attention to these supporting factors may not be maintained once the medication is stopped, highlighting the importance of holistic care. As the popularity of these medications continues to grow, so too does the need for public awareness about both their benefits and limitations. While GLP-1 receptor agonists are reshaping the landscape of weight management, they must be approached with knowledge, caution, and professional supervision. Patients and healthcare providers alike should understand that effective, safe, and lasting results come from a combination of medication, informed lifestyle changes, and careful monitoring, not from the drug alone. With proper guidance, GLP-1 medications can be transformative, but their use requires respect for the body's natural processes and attention to overall health.